Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor, available on Amazon. Let's talk dental work as a cancer patient and as a survivor. Now, a lot of this stuff are things that were drilled into our head, all pun intended, from the time we were little and learned to brush our teeth. And if you're old enough like me and you were given those little pink tablets to chew on first so that your teeth were all pink and you brush your teeth and you can see the spots that you missed, it would teach you how to brush more thoroughly. You're also taught about proper hygiene, such as flossing and everything else like that. So a lot of this stuff is common sense to us, but it changes when we have to deal with cancer and treatments and also into our survivorship. Okay, so first off, nothing changes. You still got to brush your teeth, and I'm not promoting Colgate, okay? But you got to brush your teeth. That's doesn't change anything. And also, you need to floss. Okay, again, not promoting any brand, but you gotta floss. Okay, now that may change depending on the type of treatment that you're going through, because you don't want to increase risk of bleeding from the gums, or what commonly happens is bacteria breaking loose from your teeth into your gums and into your bloodstream. That can cause a lot of bad things. And with your immune system being challenged during treatment, okay, that can be a bad thing. So, a lot of times before your oncologist will want you to see your dentist before you start treatment. That way you can get everything out of the way, teeth cleanings, fillings, crowns, whatever. Get everything out of the way before the treatments. There probably is a waiting time after you're done to get anything done. And that's pretty much all there is to that. Of course, you want to make sure that your dentist is aware of any treatments that you're getting, the any drugs, the particular drugs for your chemotherapy, and especially if you've received radiation to the head and jaw area. Okay, that's very important. So I'm going to move on now and talking about survivorship, long-term issues. Okay, you're done with treatments. You're well into remission, 5, 10 years. You really don't think anything is happening, and then all of a sudden you start having some problems with your teeth. Your a tooth breaks. You may have more cavities. You're having other issues. If you've been through radiation therapy, there's a pretty good chance that your body, that the radiation has had an impact on your teeth and jaw area. Now, one thing you need to be careful about, and I'm not going to go into the details of this because it's way out of my lane. You want to be careful with dental work as anybody who's been treated with radiation because of something called osteonecrosis. Necrosis, and I've got to watch how I say this because TikTok doesn't like a certain D word. Um, Basically, necrosis is unalive. Osteo, bone. So basically, it's a bone that's not alive. Okay, and that kind of bone is going to be more brittle, more likely to break. So yes, your jaw, if it was exposed to radiation therapy, you run the risk of having that osteonecrosis. So if you need certain dental work, such as having an implant, uh, that's a conversation that you need to have with both your dentist and your radiation oncologist. A serious conversation before you do that, because the last thing you want is an implant placed and all of a sudden your jaw breaks. Um, so another issue that can come up because of radiation, and definitely has happened in my case, is I have an issue with dry mouth, extremely dry mouth. My salivary glands were likely pretty well destroyed by the amount of radiation that I got. So, what happens is I am not able to get rid of sugary deposits off my teeth. So, basically, I have to brush my teeth after everything I have. whether it's a drink of iced tea, a drink of milk, a cookie, dinner, whatever. I have to get everything off there because my salivary glands are not working properly enough, and because of that, I can't get rid of that excess sugar. So, what's happening as a result of it? I'm losing enamel off of my teeth. So, one of the treatments that she's given me, and again, I'm not promoting any kind of products, to help me with my dry mouth, I use several products. This Biotine moisturizing spray and this Xylomelt's dry mouth. They're little tablets you stick up in your gum, and it basically keeps you salivating. Now, of course, I would rather take it the tastier way and pop a couple Starburst in my mouth. The candy that makes your mouth water, but that would defeat the purpose. So I use that stuff quite often. There's also a mouthwash that you can use called chlorhexidrin. That's a prescription strength mouthwash. However, in my case, I learned from a surgical procedure. I'm allergic to that stuff. So even though it's diluted in the dental office, I'm not sure as far as the mouthwash goes. So I can't use that. And the final thing that my dentist has me using to help with that dental enamel is sodium fluoride. I forget what the actual brand name of it is, but basically it's a prescription strength toothpaste with fluoride in it. Yes, I know our society cannot decide to agree on the importance of fluoride in teeth, but clearly it matters with my teeth. So I do use that prescription toothpaste with fluoride in it to try and save what's left of my teeth. I have lost currently 4 teeth. Basically, whenever I have any dental work to be done, I need to take a prophylactic antibiotic. In other words, I need to take an antibiotic just because. Usually it's about, I think it's 1,000 milligrams of amoxicillin. I take that an hour before I go to the dentist, whether it's for teeth cleaning, whether it's for filling, whatever. That should help fight any bacteria that comes loose or whatever during that dental treatment. Being a heart patient, this is a big deal, but also because I've got immune issues. And if you're going through cancer, your immune system has been challenged. So you want to take this extra step. Again, this is something you discuss with your dentist and your oncologist. So, one other precautionary thing that I want to warn you about, there may be certain chemotherapy drugs that do cause problems, such as bleomycin. Okay, bleomycin was used in my treatment. Bleomycin produces something called bleotoxicity when exposed to oxygen. Why am I bringing that up? Because when I have tooth extractions, and like I said, I've had 4, one of the things oral surgeons like to do to help the healing along the way is put their patients through hyperbaric treatments, oxygen treatments. Unfortunately, having a history of bleomycin, I can't do that because the oxygen works in a way to reactivate that bleomycin. It doesn't matter how long ago it's been. That's what I've been told by my doctors. So what happens is I have to go through a procedure called protein-rich plasma, PRP. Okay, and basically what they do is they take blood from me, they put it in their little spinny thing and spin it till there's nothing but plasma left. And after they've taken the tooth out, before they stitch up the hole, they put that plasma in the hole of the bone of the jaw, and then they seal it up. And then my own body basically helps that jaw heal. I'm 4 for 4 with that method, so that works. But that's just something that you want to be aware of. I think that about covers it. There's a lot. Dental seems easy, but it's something that you definitely need to be aware of. If you have any questions, you can feel free to message me, or more importantly, talk to your dentist, your oral surgeon, or your oncologist for more advice. Until next time, this is Paul's Heart.